medical influencers. When you hear the term medical influencer, what comes to mind? A healthcare professional using their social media platform to spread awareness. Dr. Rakshita is a final year medical intern and an emerging medical influencer. With thousands of followers on Instagram and TikTok, her content has gained significant attention and social media presence. But when you dig deeper, the issues become glaringly obvious. Multiple posts showing her posing or recording inside operation theaters, patient wards, even the ICU. In one reel, she's pretending to administer anesthesia while acting like she's overseeing the entire procedure, something an intern is neither trained or authorized to do. Hello everyone, welcome back to my channel. I am Dr. Bhavesh Varandani. Today we are discussing a topic that just not trending but also sparking debate across the medical and digital communities. Medical influencers. When you hear the term medical influencer, what comes to mind? A healthcare professional using their social media platform to spread awareness, promote healthy habits, or demystify complex medical procedures. That's the ideal image, right? But the reality of Indian medical influencers is far from that ideal. We are now seeing a wave of medical influencers who seem to prioritize content creation over patient care, ethics, and professional responsibilities. Today I am breaking this down with some example, questions, and some much needed clarity on where the line should be drawn. The case of Dr. Rakshita Singh. Dr. Rakshita is a final year medical intern and an emerging medical influencer. With thousands of followers on Instagram and TikTok, her content has gained significant attention. At first glance, it might seem inspiring to see a young doctor balancing her internship and social media presence. But when you dig deeper, the issues become glaringly obvious. First, misinterpretation of roles. Interns in Indian medical colleges rotate through various departments over 12 months, whether it's OBG, medicine, surgery, pediatrics, orthopedics, anesthesia, and so on. The purpose of this rotation is to provide a well-rounded exposure to all aspects of medicine. However, for over 6 months, Dr. Rakshita is consistently posting content portraying herself as an OBG resident. Here's where the misinterpretation becomes problematic. In her post, she's seen wearing scrubs, often claiming to have participated in major procedures like cesarean section and deliveries. She frequently captions her post as if she's solely responsible for these procedures, overshadowing the actual team involved, including senior resident, consultant, nurses, and anesthesiologist. This creates a false narrative, misleading her audience into believing she holds responsibilities and expertise far beyond her level of training. After misinterpretation, another concerning aspect of Dr. Rakshita content is her choice of filming locations. Multiple posts showing her posing or recording inside operation theaters, patient wards, even the ICU. In one reel, she's pretending to administer anesthesia while acting like she's overseeing the entire procedure, something an intern is neither trained or authorized to do. These actions not only misrepresent her role but also compromise patient privacy and hospital protocols. The operation theater is a sterile environment, and constant use of cameras or phone can affect the patient's safety. Not just the misrepresentation or filming location, the most troubling aspect of her content is apparent lack of patient consent. Many of her posts feature patients in the background either unconscious or during procedures. It's unlikely that patient or their families gave explicit permission for these images and videos to be shared online. Hospitals are meant to be a safe space for patients whether their dignity and privacy are upheld. By using these environments as content for social media, Dr. Rakshita is prioritizing her content over her ethical obligation as a doctor. Dr. Rakshita case is not isolated. It reflects a broader trend of medical professionals crossing ethical boundaries for social media clout. From dance reels in hospital corridors to staged photos in ICUs, their behavior raises serious concerns about the integrity of the medical profession. So its impact on public perception. The actions of influencers like Dr. Rakshita has far-reaching implications. First, erosion of trust in doctors. Patients trust doctors to prioritize their care above everything else. When medical professionals are seen prioritizing social media or patient well-being, it diminishes the trust. Even might become a factor of violence against doctors. She just not diminishes the trust. She is also misleading aspiring doctors. Young students aspire to join medical field might perceive this behavior as normal or even aspirational, leading to a culture of content or values and ethics. She is also undermining the genuine medical influencer professionals who genuinely use this platform to educate. So what needs to be changed? Hospital must enforce strict policies. No filming or photography in sensitive areas like ICU or operating theatre without proper permission. Patient consent should be mandatory. Every piece of content involving patient must have documented consent, explaining how and where the content will be used. Professional conduct needs emphasis. Medical colleges and institutions must reinforce the importance of ethics and professionalism in their training programs. It's just not about the policies, consent, or professional conduct. Even accountability for influencers should be done. Platforms like Instagram and YouTube should hold influencers accountable for violating privacy and ethical standards, especially in sensitive professions like medicine. Final thoughts to all the aspiring doctors and medical influencers out there. Remember why you choose this field. Social media is a powerful tool, but it comes with responsibility. Use it to educate, inspire, and inform, not to mislead or chase fame. To the audience, be critical of the content you consume online. Not everything you see is authentic or ethical. Support professionals who add value, not those who compromise their integrity for views. Let's discuss this in the comments. What's your take on medical influencers like Dr. Rakshita? Do you see this as a harmless content creation or a serious ethical violation? Thanks for watching, and don't forget to like, share, and subscribe for more honest discussion on topic that really matters.